Hi, I'm Elaine Brewster. Welcome to Aspects of Energy, a forum where we talk about ways that we can raise your energy. In my book, which is just so fun to actually hold this book, on page 63 and 64, it says this: harking back to our school days, most of us were taught how certain body systems function. For instance, when I taught elementary education, I taught the muscular, skeletal, and circulatory systems. I did not teach other systems like the lymphatic, immune, and endocrine systems. And the energy system, the body as an electrical system, never mentioned at all. Today, we are really fortunate to have lymphatic specialist Mike Bond on with us. Mike has done so many things, and he works, his place is called Revive, and he can give us the site. I think it's reviveptcryo.com, and he does a cryo chamber. He does pulsed electromagnetic field mat. He does red light therapy. He does hyperbaric oxygen therapy. He does a whole lot of things. He's been a physical therapist for 30 years or so, Mike? We're 28 years. There you go. We are very interested, first and foremost, about the lymphatic system. That's a mystery to most of us. So we would love you to tell us about it and tell us what it is, and then you go on from there.
Okay. The lymphatic system was a mystery to me at one point. Now it's almost become second nature to me, that in such a way that it's almost a mystery to me why other people don't understand it, because it's second nature to me. The lymphatic system is something that came to me not by my choice. I went kicking and screaming. I was trained because my employer said, "You shall go get trained." And I went whimpering with a bad attitude, with a chip on my shoulder, thinking I don't want to treat lymphatic clients. It's not in my interest pool. And I sat in a 2-week course, full days in Florida, pouting. By day 3, I realized there's a test at the end of all of this, and I need to pass the test or I will be embarrassed to go back home and tell people I didn't pass, because I didn't pay attention. So I started to try and find ways to interest myself. And I thought the interesting thing to me is how it can be applied to my outpatient orthopedic clinic. I was running it on the side and working for a home health and hospice agency. The home health and hospice agency sent me to the training because they needed a lymphedema specialist. When I started to focus in on something, any little piece that interested me, all of a sudden it started to fall into place. The chip left my shoulder, my attitude brightened, and I started to focus and actually learn some things. What I learned first about the lymphatic system is that it is the immune system. It's the system that gathers up crud, crap, and debris, for lack of better terms that everybody will understand, from the interstitial space of the body. There's the blood space, all of the vessels. There's the cellular space inside all of the cells, and then everything else in between, that's in between cells, in between blood vessels. They call it the interstitial space. There's a bunch of fluid and a bunch of junk out there that's leftover byproducts of muscles burning energy, cells burning energy, and things that didn't get absorbed and used by the body. There's also bacteria, viruses, dead red blood cells, hormone cells that are left over, and other stray random cells. The vascular system, the circulatory system that we're familiar with, has the heart, the arteries, and the veins. And in the textbook, everything is colored red and blue. And it all makes perfect sense when you look at it. Oh, that must be an artery, it's red. That's a vein for sure because it's blue. And then there's this system in the textbook that's green. And everybody wonders, what is that green system? It's the lymphatic system. It intertwines with the circulatory system and gathers up basically everything that the circulatory system doesn't have openings big enough to gather up, such as those excess stray cells, the dead cells, and a portion of the excess water. Water is the other thing that I learned about in the lymphatic system that is a problem child. We take in water to stay hydrated. We use a lot of water in our cells and for our bodily functions. However, our country, our nature, our lifestyle tends to cause us to move towards inflammation. As we age, what we eat, how we live, how we don't exercise, sometimes how we do exercise, tends to push us towards inflammation and inflammatory cycles. Our body is amazing at dealing with inflammation to a point. The lymphatic system is one of the things that makes it amazing. The circulatory system gathers up 80 to 90% of this extra water that the body doesn't use for metabolic function. The lymphatic system gathers up the other 10 to 20% of that fluid. So the lymphatic system has an important role in fluid regulation and swelling regulation. Most of the disease processes that we encounter have at least a primary or secondary inflammatory cycle as part of the problem that our bodies encounter with those disease processes. So the magic of the lymphatic system is that it is the immune system, it's the inflammatory regulatory system that helps the circulatory system deal with what it can't deal with. And it cleans up that crud, crap, and debris that's hanging out in the tissues. All of the metabolic byproducts, all of the stray cells, extra cells, kind of if it was your refrigerator, it deals with all of the leftovers. Our cells use the food and there's leftovers. What the body doesn't use, the lymphatic system cleans up. Lymphatic system takes it back into the circulatory system. It gathers it from distant parts of the body and it draws it up, and it rejoins the circulatory system up near the collarbones. And it re-enters the circulatory system there. And then the lymphatic fluid becomes a portion of the blood. So you have this fluid that exits the circulatory system into the interstitial space to feed the cells, to bathe the cells, to give them all the nutrients and water they need. Anything that the cells don't use becomes leftovers that the lymphatic system gathers up and takes it back to the circulatory system where the liver and the kidney can process it and reuse what the body can make sense of and refuse or eliminate what the body can't make sense of. So we have this system that is green in the textbook, and it looks so gentle, so unappetizing, unappealing to anybody, but it's a major role in keeping the body healthy, free of inflammation, free of disease. There was a study done, it's been a number of years ago, and the numbers have changed, but the study was a survey of Stanford University medical students. They surveyed current students and past students, as well as faculty. And the survey included this inquiry about how much time out of the 4 years of medical school do you spend learning about the lymphatic system? Now, mind you, I just told you that the lymphatic system is the immune system. How much time do medical students spend learning about the lymphatic system or the immune system? They tabulated the survey results, and on average, they came up with the number 15 minutes. 15 minutes to learn about the immune system. I know, I see your face and you're mouthing words, and I'm in disbelief as well. Now the numbers have changed a little bit. It's getting better, realizing that this system needs to be understood much better than it currently is for patients, clients to be healthy. And for us, medical practitioners, non-medical practitioners, to live a healthy, clean life, knowledge is power. Knowledge about the lymphatic system is power over many things that we were powerless about before. So 15 minutes in 4 years of medical school to learn about this system that I find so fascinating after I got the chip off my shoulder and paid attention in my class and got certified as a lymphedema specialist. Nowadays, what I find, the lymphatic system has become an enormous part of my practice. I use the skills that I've learned to manipulate, to stimulate the lymphatic system with, they call it manual lymphatic drainage in a lot of locations, or lymphatic drainage massage, or anything of the sort where people are dry brushing, skin brushing, where they're working with the lymphatic system. It's all different ways to manipulate, to stimulate, and activate the lymphatic system to work faster. Just like we have a heart rate, we take our pulse and we feel how many beats per minute the heart is pumping. When we exercise, it goes up. When we rest and sleep, it goes down, but it's got its baseline pumping rate. The lymphatic system also has a baseline pumping rate. It pumps so many beats per minute. It ends up being 6 to 10 beats per minute that it has a little pulse. It doesn't have a central pump. It doesn't have a heartbeat, but it has a peristaltic-like contraction, much like the colon. When it moves things, we'll just say things. We won't say any other words. When it moves things or stuff through the colon, it has a peristaltic waving contraction. The lymphatic system has a peristaltic-like contraction. It has smooth muscles in the larger vessels that move fluid through the larger vessels. As it moves fluid through the larger vessels, it creates a little bit of vacuuming distally. So it increases the pumping rate distally. It increases the suctioning. When I do manual lymphatic drainage and some other techniques with the lymphatic system, I can get the lymphatic system to pump almost 60 beats per minute. So we go from 6 to 10 beats per minute to 60 pulses per minute. So imagine if the lymphatic system is responsible for removing a portion of the water from the interstitial space, a lot of the crud, crap, and debris, and I come along, innocent looking Mike, and I do a lymphatic drainage session. I then allow your body to pump 10 times faster to remove water, inflammatory process, crud, crap, debris, and junk from the tissue. So the important part of my practice is whether it's a sprained ankle from an injury, whether it's a chronic debilitating illness, whether it's a cancer, whether it's a metabolic process or a disease like Alzheimer's or Parkinson's, or kids on the autism spectrum, just about anything you can name in the medical encyclopedia, inflammation is at least a part of the symptoms. I may not cure Parkinson's, I may not cure Alzheimer's, I may not cure autism, I won't cure cancer, but I can cure a lot of the secondary problems related to it with my manual lymphatic drainage techniques. If somebody has a dysfunction with the lymphatic system, there's some specialized techniques that act differently with my lymphatic drainage sessions to clear the system and help the body find a new place for the fluid and junk to be processed. A diet that I recommend. Somebody asked the question, is there a diet you recommend when working with the lymphatic system? Because our bodies tend towards inflammation, or part of the reason why our bodies tend towards inflammation is because a lot of what we put into our mouth is inflammatory. Processed foods, anything with words in the ingredient list that you can't pronounce easily without a tongue twister, probably have a secondary nature of affecting the body towards inflammatory cycling. So eating green and clean is a fantastic high antioxidant diet to make the lymphatic system as healthy and optimized as possible. Any questions about any of that? The whole anatomy of the lymphatic system is fascinating, but maybe it's only fascinating to me.
Well, I am sitting here aghast and amazed. It's really, really interesting. So number one for me is, so this is a myth. I've heard forever that the lymph system didn't really have any way to get stuff moving through unless you moved. But you're saying there is a peristaltic action that's in there, that's inherent.
There is. Yeah, my lymphatic system, your lymphatic system is moving fluid right now. It's gathering a portion of the water in the interstitial space and all of the leftovers that are in the interstitial space. If it didn't work, if it stopped working, in fact, they did a research study with animals, and I'm not a huge fan of animal research, especially what involves the death of animals or that type of research. However, this research was done long ago when the rules were different about research, and a lot of things were allowed to happen that we don't allow today, or we try to accomplish differently today. That research study took some dogs, and they up it by, I said by the collarbone is where it rejoins the circulatory system. They went up by the collarbone. They found those connecting vessels that drain into the circulatory system, and they tied them off. They put a ligature around them and just choked them off. So that little lymphatic vessel got squeezed closed. All of the animals that had their lymphatic system turned off, per se, died within 48 hours. So a dysfunctional lymphatic system, any part of the lymphatic system, a breast cancer that has 2 or 3 or 10 lymph nodes removed from the axillary node cluster, all the way through to those dogs that had the lymphatic system entirely turned off. There's a portion of the lymphatic system that's not working correctly. Therefore, it won't drain that area that it's responsible for correctly. So somebody with a breast cancer might end up with a swollen arm with unhealthy looking skin because their lymphatic system isn't removing the junk from the area and the water. So they'll swell up and their skin won't look super healthy. And it will progress and get worse and worse unless something acts on the lymphatic system to make it pump faster. The lymphatic system does have a baseline pumping rate, yes.
Well, that might be of interest to a lot of people. For instance, something like breast cancer. Rather than have lymph nodes removed, wouldn't it be better to somehow try and break up the blockage, and get movement going again?
Yes, ideally that would be optimal. However, in the case of cancer, remember the lymphatic system is the immune system. It's right now in my body, probably my lymphatic system is fighting precancerous cells. It may be fighting cancerous cells. I don't have a cancer diagnosis, and heaven forbid I put anything like that out to the universe. I don't want cancer or suggest anybody get cancer, but we know that it happens. We have loved ones, we have neighbors, friends, acquaintances that it's hit their family. Sometimes the lymphatic system isn't sufficient to kill the cancerous cells, the precancerous cells, and it invades normal, healthy surrounding tissues and grows into a cyst, a tumor. Sometimes the very lymphatic system gets infected by the cancer, often in the lymph nodes, because the lymph nodes, the vessels gather the fluid, the lymph nodes are the filter where a lot of the immune response happens. There are T cells and B cells in the lymph nodes that fight infection, fight cancer, fight abnormalities. And it's pretty good at killing off what needs to be killed off and flushing out what needs to be flushed out, and then sending it on to the circulatory system so the liver and kidneys can finish the job. But because it's filtering all of those cancerous cells, if the lymphatic system wins, we end up, in our car, it's the oil and the oil filter. If the oil filter cleans all the junk out, it stays, the oil stays clean and lubricates our engine. If the filter itself gets junked up or plugged up, then the filter itself is quote unquote infected and no good to the car. Sometimes a lymph node becomes no good to the body because it in itself is diseased with a cancer that it couldn't fight well enough, and it loses the battle. So a doctor doing a cancer surgery, if they go in, they do a biopsy. It used to be back in the day, 1960s, 70s, and even up into the 80s and 90s, a common surgery for breast cancer was to remove the breast, the pec major, pec minor, and all of the lymph nodes in the area, figuring we will just take everything out that might have cancer. And people were left with skin laying over the top of their rib cage, a very haunting xylophone look, with dysfunctional arm to a degree because they don't have a pec muscle. I don't like the thought of anybody living without any of their muscles.
Yeah.
So it's very disturbing to me that many healthy pec muscles were removed and many healthy portions of the lymphatic system were removed. Nowadays, the surgeons, the oncology surgeons, cancer surgeons, they will test a lymph node and see if it has cancer invading the lymph node. If it does, they'll test the next lymph node in the chain of lymph nodes. They're daisy chained together in a cluster. They'll test lymph node after lymph node, send it to the pathology lab and see if it's infected with cancer. If it is, they take the next lymph node and keep testing. Sometimes they'll see a heavy dose of cancer, a heavy cancer, and they'll take several lymph nodes and send them to the pathology lab to speed the process of the surgery. But they're very isolated anymore compared to how things used to be. So you might see that they take 1 or 2 or 4 lymph nodes, whereas previously they would take all the lymph nodes, all of the muscle, everything.
What does a lymph node look like if you were a surgeon?
If I were a surgeon, I would be retired at this age. They're by name, they're nodular. They can be very small, the size of a pinhead.
Oh.
They can be all the way up to the size of a grape, naturally, normally. Some people are born with very large lymph nodes. Some people are born with very, very small lymph nodes, just like people are born with a large nose or a small nose, or a very long, beautiful nose, very long, skinny. So lymph nodes can range in size. The concern comes when you have a lymph node that is one size and it changes size. That's when there's an indication of that lymph node is doing something different than it's done its entire lifetime. It's processing something. If you get something going on with your sinuses or your throat and you go to the doctor, they poke underneath here and what they're feeling for is lymph nodes. And they ask you, is that tender? Because lymph nodes that are processing something are enlarged and they're sore, they're tender. So the doctors are looking for pinhead grown bigger because it's processing something, and now it's tender because it's fighting an infection and it's got an inflammatory process going on in there. Inflammation is painful, even in the lymph nodes. So if I was looking at it in a surgery, I would look for anything pinhead size all the way up to olive or grape size. Look a little bit like a kidney bean. They kind of have that kidney bean shape, where they're round on one side and hollowed out on the other side, and bean shaped, that type of bean shape.
We have a question. How often should I go to a practitioner like you to keep my filter system, my lymph system, in good repair?
Well, if you go to a practitioner like me, you don't have to go very often because I will do an amazing job. If you go to anybody else, go frequently. No, I'm kidding. I have a huge ego, the size of my long nose. That's a very personalized question. If your lymphatic system in and of itself, by itself, is good at cleansing your body, you may need very little help from somebody else, from an external practitioner working your lymphatic system. Some people, I have people that come in to see me every week. I have a woman right now I'm working with. She comes in twice a week. Another lady that came in this week comes in every other week. And it's for her, she kind of balanced out the how often do I need to come to feel like I'm keeping my house clean. You know, everybody vacuums their carpets at a different frequency depending on how much dirt gets tracked in. Lymphatic system is the sanitation department of the body. How much help does yours need? If you tend to be a person that heals slowly, feels sick longer than other people, you probably should have a little more help because your lymphatic system is struggling to keep up.
Mm.
If you tend to be quite healthy, you exercise a lot and keep things moving, pumping, flushing, and you hydrate well, you eat clean, your lymphatic system is probably healthier than the average lymphatic system.
Mm.
And you may need to go in once a month. I recommend people go in once or twice a month, just as a baseline. And then you tailor that to how was I with my diet? How was I with my exercise this month? Do I need more or less this month? Once a month, I would say, is optimal. Very few people come to see me that with that type of frequency. They come in when they have a problem, and I help them deal with the problem. And then they feel like they're good. Oh, you solved my problem. Now I will go on my own. I teach them to do their own lymphatic drainage. There are methods and mechanisms to do your own lymphatic drainage. There's skin brushing, dry brushing, self-lymphatic drainage, and some techniques. But I would try and go monthly. I saw somebody ask, what's the cost? I'm very inexpensive. I feel like what I make doing lymphatic drainage is maybe unfair compared to what other people charge, unfair to myself compared to what other people charge and what they're making for a session. However, I feel it's very fair for me to charge what I charge and earn that much per hour. I charge $90 for a 50-minute session of lymphatic drainage. That allows people to come in more frequently. I know practitioners that charge $120 to $150 for a 50-minute session. I don't feel good about that for me. I have to be able to look at myself in the mirror and feel good about what I did that day and how I helped people.
Right. When people exercise itself causes sometimes inflammatory responses. It causes a lot of toxins to be released. It causes its own set of issues. But you're saying that you would rather see people exercise and then let the lymph system, deal with what it needs to rather than be sedentary?
Yes, all of the healthy benefits of exercise. Yes, muscles burning release metabolic byproduct from energy burning, from muscle burning energy. However, the little caveat to that is exercise also induces lymphatic movement. So besides lymphatic drainage, exercise will increase the pumping rate of the lymphatic system. So while exercise induces lactic acid, and lactic acid needs to be removed or it builds up in the tissues and painfulness and icky feeling, it also creates self-cleaning. Exercise causes metabolic byproducts to be produced, but it also causes the lymphatic system to clean things up.
Okay.
So I like to do lymphatic drainage and combine it with some simple exercise to emphasize both ways to ignite the lymphatic system.
Okay. I have another question that's based on that. There you go. Your picture was frozen for just a sec. I'm curious about if the beats, if it's 6 to 10 pulses per minute, and then you can raise it up to 60, so 10 times. Is that too much for the body? What have you noticed?
No, it's temporary. They've measured that lymphatic system increase to stay above baseline level for up to 6 hours. But it's like a ski slope. It's really fast right after the lymphatic drainage session, and then it tapers away slowly. And then it gradually ramps all the way down to baseline again. So it's like, when we exercise, we cause the heart rate to go up. Is that good for the body? Well, if you have a bad heart, different disease processes with the heart, it's not great to stress the heart that way. And those people need to be careful with how they exercise. If it's the rest of us that don't have diseased hearts, it's good for us to exercise and challenge the heart a little bit, and challenge the muscles, even though it does create some metabolic byproducts. Our bodies deal with that quite well. It can lead to some byproduct production. And if the lymphatic system isn't helping pump it out fast enough, it can get stuck in the tissue. That's why I recommend people go get lymphatic drainage frequently, because our bodies, typically we hang on to more water, crud, crap, and debris than we get rid of. And it just builds up into our tissues. Sometimes it's the reason why we just have icky feeling days, and we don't know why. It doesn't show up on x-rays or MRIs or images or blood tests. It's just because our lymphatic system is feeling sluggish, it's feeling overwhelmed, and we get it cleaned out. And I had a text this morning from a colleague that attended my most recent lymphatic drainage class. I teach a lot of classes. If where you are, you have lymphatic drainage education needs, reach out to me. If it makes sense and we can get a large enough group of people, I will travel there and teach a course. She reached out to me and said, Mike, I just used some of those amazing techniques we learned over the weekend on myself because I was feeling a little congested, and now I'm nauseated. Why am I nauseated, and what do I do about it? I said, Monica, you're nauseated because you're feeling congestion, and you stimulated the immune system to gobble up and return to the circulatory system all of that junk. And now your circulatory system, your liver, your kidney, your system is feeling overwhelmed with junk. So you need to hydrate, you need to move, you need to flush your body out, and you'll feel the nausea go away, you'll feel better. So lymphatic drainage frequently, regularly is an awesome thing for our health and wellness.
Giselle is part of the Lymphatic Society up in Winnipeg. Do you have a question? Are you thinking of some things, Giselle?
I'm not really part of the society, but I have had experience with a lymphatic problem. 5-6 years ago, my right arm was, no kidding, double the size of my left. And when I went to see my regular doctor, the regular doctor never said anything about lymphedema, but prescribed for me to go get a compression glove, or sleeve, I should say. So off I go to that place to get that. And the lady there luckily knew more about all this than to just give me fill the prescription, which is very expensive too. She says, we need to get you to get some lymphatic drainage done, because in a couple of weeks, you're going to need a new size glove or sleeve. And sure enough, she referred me to this lady who does lymphatic drainage massage. It is an amazing procedure. My case was pretty severe at the beginning, that I was going a few times a week. And I don't know, Mike, if you do this too, but after a drainage, if it's severe, you can wrap with that white bandage, whatever. She wrapped my whole arm, my fingers. Bill learned how to do this. You should have seen the first time he had to do this to me. Must have taken 3 hours. But anyways, it plus the massage. Yes. She also taught him how to do it. It's a very, very, and I imagine that's what you do also, very slowly, like just so lightly, but it does work. It is an amazing specialty. And I go back to 10 years ago. I had a similar problem. There was no talk from my rheumatologist at the time that this could be lymphedema. But luckily, 5 years later, when it came up again, I was able to get that treated. So it is quite a specialty. Bill, do you want to add something to that, or did I miss anything?
Well, Giselle actually it was part of a presentation, or gave her case with the Lymphedema Society and her mode, and it was quite amazing to see what some people go through with when your lymph system isn't working.
Yeah.
And so Giselle was able to take part in that and give her experience and assist. Assist, because people are really ignorant and naive to what is happening out there, and as that a significant part of our health process.
We also have purchased, and I like to think that it helps, a Vibe machine.
Okay, if I could add to that.
Okay.
I wanted to ask, there are ways that we could do things for ourselves. We've heard of rebounders. Maybe Mike can comment on that. Rebounders, but in the last year ago, we were aware of Vibe machines for not only exercise, but enhancing your rest of your health. And so we've been using this for a whole year, and some of the research we've done on that relating to rebounding and Vibe is that it is significant, or it can be a significant part of helping the lymphatic drainage system work. I'm just interested as to what Mike would say to that. And it certainly seems to be helping us overall and doing a variety of things for us. It's a very interesting process. And go to vibration therapy online and do your research, but it's a very interesting process. Mike, what is your comments on that?
There are quite a few machines that advertise that they're good for the lymphatic system and lymphatic drainage. Before going there, though, back to your comment about the bandaging, there are two similar related techniques or processes that happen with the lymphatic system. When somebody has lymphedema, the process would be to do lymphatic drainage, some skin care, some lymphatic drainage, and bandaging. That would be in the case of a lymphatic system that's not working correctly. To do a manual lymphatic drainage massage for somebody like me, I don't have lymphatic system problems. My normal lymphatic system just needs to be boosted for a little bit. So I do a lymphatic drainage session, which is a skin stretch. It's a very light massage, very gentle, very slow, very methodic type of massage. So kind of two different things. Lymphatic drainage is just the massage technique. Lymphedema treatment involves lymphatic drainage and lymphedema bandaging. So now related to that comment, because I wanted to kind of clarify, the lymphatic drainage massage is a very light skin stretch, soft, just moving things subtly type of technique. A lot of those machines, what they do is move the skin, move the tissues, move fluid very subtly, very gently, and very gradually. That type of activity can stimulate the lymphatic system, or the lymphatic system is a rest and repose system. It's part of the parasympathetic innervation. Parasympathetic system innervates all of the things that are the rest and digest parts of the body. So all of the autopilot functions and features of the body, that's what the parasympathetic system innervates. The vagus nerve is the largest parasympathetic nerve. Anytime you do anything rhythmic, meditative, vibratory, rotational, it stimulates the vagus nerve. If you stimulate, it sounds backwards, but if you stimulate the vagus nerve, it causes the lymphatic system to pump faster. Vagus nerve excitement causes lymphatic system improvement, and that causes greater relaxation. Lymphatic drainage massages would be one of the most relaxing massages you would ever get. It's a vagus nerve stimulating massage. So the vibration machines, the rebounders, the chi machine, a lot of machines that do vibration and wave-like motions, rhythmic motions, it will stimulate the vagus nerve. Meditative breathing, diaphragmatic breathing stimulates the vagus nerve. It can be very relaxed. There's a reason why meditation experts want you to breathe deeply and use your diaphragm. They know that you are going to stimulate the vagus nerve, and neurologically, you can't help but relax. Oh, you helped me learn this technique. No, I helped your body figure out that that's how you get your vagus nerve to relax you.
Wow.
That's how your vibration plate, your rebounder, that's how I tricked your body into doing its normal physiology to make you relax, which stimulates the lymphatic system.
Right.
So that's kind of the mechanism of how it works.
Thank you. Dee, as a nurse, are you thinking of some things, Dee? Oh, were you're muted.
Let me unmute. Thank you so much, Mike. This is fascinating. And we probably had 10 minutes of the lymphatic system when I was being trained 100 years ago. But how do you count the beats per minute? I mean, you know, the pulse is finding a pulse point, but on the lymphatic system, how do you do that? And then I was wondering about, is a rebounder beneficial as well?
Yes, rebounder we just discussed. Yes, it's very beneficial. It can be very relaxing, meditative, rhythmic. In the circulatory system, we have the points in the body where we feel for a pulse, and it's a strong pulse with a central pump. The heart is a strong central pump, creates all kinds of pressure, right? Well, that's how we get our blood pressure. Is what is the pressure inside those vessels? How much strength does the heart have pumping blood inside those vessels? That's what we're measuring with blood pressures and different points of squeezing the blood vessels. When does it slow down and stop, and when does it restart? The lymphatic system, we don't have a pulse point per se. We can't put our finger somewhere on the body and say, oh, there it is. That is where I feel the pulse of the lymphatic system. The pumping rate of the lymphatic system was researchers that put probes into lymphatic vessels and measured baseline pumping with microscopic ultrasensitive equipment. And they found that on average, that's the pumping rate, the average pumping rate. And then they had people come in and do lymphatic drainage and measured how much faster does it pump on average when we do lymphatic drainage, and how does exercise affect it. So that's where they got the numbers, was with ultrasensitive equipment measuring physiology in the body. But some practitioners say, and I don't know, I shouldn't say claim, because they very well could. There are energy workers that feel things in other people that I don't understand. I don't get how energy workers feel and understand what they understand. I know when somebody has bad energy. I definitely feel that. You have bad energy and I don't want to be around you. But energy workers that sense things almost intuitively that I don't understand doesn't mean it doesn't exist because Mike doesn't understand it. Some people say they can place their hands on certain areas of the body where there are larger lymphatic vessels, and they say they can feel it. I'm developing my touch. So I've been practicing lymphatic therapy for years, and I'm starting to get the art part of it. I've got the science part. I'm developing the art still. So can I sense it? Yes, a little bit. Are there people that sense it and feel it better than me? Oh, yeah. My luck is that I'm smarter than I look.
I think Heather has got something to say about this, or a question.
Oh, thank you, Mike. This is awesome. I have a question about, do you know anything about the chi machine? It kind of it moves.
Yes. That I mentioned that the vibration machine.
Oh, is that what it's called?
The
Okay.
chi machine. Well, there's a vibration plate that you stand on and it just jiggles and vibrates. I did that with my phone. There's your vibration machine. The chi machine, you lay down and you put your feet,
Yes.
your ankles in horseshoe shape, and it waves back and forth.
Right.
And kind of creates a rope of waves with your legs. Very meditative, very relaxing. Besides just being relaxing and kind of meditative, they say that it stimulates some of the lymph nodes up in the groin area because of how it waves the legs. They've got a very strong publication of articles saying it affects the lymphatic system. Do I agree? Abso-flippin'-lutely yes.
Okay, thank you.
Because it stimulates the vagus nerve.
Yes, I can feel it. And when it stops, there's an energy that you can feel flowing through you. And I'm kind of thinking after you said that, it might be the lymphatic system that is working more so that I can feel it. I feel things in my body, you know, when they're moving or when they're not moving. I'm an energy worker. And so I can kind of see where you're going with that.
You feel things in your body. Do you hear voices too? I hear voices. I'm kidding.
Of course. Doesn't everyone?
The voices in my head speak German. I have no idea what they're saying. Yes, what you feel. I mean, do a simple little, first grade science fair project. Go stand out in the middle of your room where you're not at risk of tipping over any furniture or breaking anything, and just do windmills with one arm. Sorry, not both arms. Do windmills with one arm, and then just pay attention to how that arm feels after you do windmills.
Yes.
It will feel lighter. It will feel energetic.
Yes.
Because when you do windmills, you affect the lymphatic system from the armpit all the way down your arm. And what you're feeling, the lightness, the energy that you're feeling is the heaviness of the inflammation leaving.
Mm,
Lovely.
wow. Thank you.
Yeah, thank you.
We've got some more thoughts coming from Winnipeg.
Yes, Mike mentioned in his introduction, he mentioned red light therapy. Now, it's been about 6 years or so that I've been undertaking some red light therapy in the 600 to 700 range, whatever. Light is very significant to the body versus UVB and UVA, whatever. Now, I'm just wondering if this is the same thing that Mike would refer to as well, which is red light theory. Now, the red light theory, red light therapy that I use, it's supposed to, and it made very much sense to me that as we grow older, our vessels, our cells, or whatever, can become thicker. Red light therapy is supposedly thins it out, especially our blood vessels, our veins and arteries, whatever. And I'm thinking, as Mike is talking about the lymph system, that too. So maybe Mike can comment on that and the significance, not only the lymph system, but to the body overall and to our slowing the aging process again as we go older.
Red light therapy, red is a wavelength, a certain wave, very, very specific wavelength of light. Blue has a different wavelength. It's how it hits our eyes. And we interpret different colors based on that wavelength. Red is going to be the same wavelength no matter what the creative device is, unless it's just a filter that's colored red. But if it's an actual red light machine, it will be a red light therapy device. Even if it's not called a red light therapy, it will be red light. So the effect that red light has when you shine it on the body is it increases circulation and it causes the cells to produce their type of energy better. So if anybody remembers back to physiology class, especially exercise physiology or even biology class, you may have studied the Krebs cycle. That's the cycle where cells create ATP, adenosine triphosphate. ATP is cellular energy. The mitochondria produces ATP. That's where it all happens, the energy wheelhouse of the cells. If you go into a salon and you're getting thin on top and you ask them what they can do for that, they'll say, well, we've got this hat that you can wear, and you come in here 2 or 3 times a week, 3 or 4 times a week, whatever their protocol is, and we'll put this hat on you and you'll start to regrow hair. Well, I've been losing hair for some time. Why would this machine cause me to regrow hair? Basically what it does, it shines red light onto my hair follicles, helps my hair follicles produce more energy than they're currently producing so they can be better hair follicles. Skin cells, it reduces fine lines and wrinkles because it makes skin cells be better skin cells. Makes cells in our body be better at what they're doing because now they have the energy to do it. As we age, we lose energy. We lose energy production. Krebs cycle goes downhill like a lot of other things. So red light therapy I use a lot of because it causes the cells that I shine it on to be better cells, and it increases circulation. So if I have inflammation and I'm trying to get rid of it, I want to improve oxygen delivery to the tissues and improve junk removal from the tissue. If I increase circulation, I improve the flow through, and so I can clean the area out. Taking the hose to your deck, just the flow through of flushing through the area. So red light is very, very healthy. I often do that in combination with pulse electromagnetic field therapy. The pulse electromagnetic field is Mother Earth energy delivered to the body. It's a Mother Earth simulating device. It creates kind of that natural healing energy of why we feel so peaceful when we go hiking. Yet we're away from cell phones, we're away from work, we're away from cement and bricks and asphalt and power lines. And sometimes we don't have cell phone reception, and that's very relaxing in some ways. But we're away from all of that stuff that causes negative electromagnetic energy to be delivered to the body. And we're out at one with Mother Nature where there's positive electromagnetic energy. Well, if we can't go hiking and be with Mother Nature, we can at least take our shoes off and go wander around outside in the garden barefoot and connect with Mother Earth. Or we can use a simulated device and go lay on a nice warm table and do pulse electromagnetic field therapy inside where it's comfortable and warm, and get a delivery of that type of energy. Even though it's created artificially, it simulates Mother Earth's energy.
Mm-hmm. Wow. Mike, this is just fascinating. And you are a really, really good teacher. You are able, and many people are not, many, you're able to explain things so well that we're understanding them. We would love to have you on another time talking about some of the other things that you do. Do you have one last comment, Sandra?
I want to ask one question. We work a lot with magnets, and there are a couple of people we've worked with who have the large arm and the lymphatic drainage issue. I don't know of a lymphatic drainage therapist or physician in my area of Richmond, Virginia. What would you recommend I do for those persons? And on that, are you familiar with the effects that magnetic energy or a grounding pad could make?
Absolutely. So number one, what I would recommend is invite Mike to come and teach a course out there. Gather a group of medical professionals, massage therapists, physical therapists, energy workers, doctors, nurses, and let's do a lymphatic drainage course out there. Secondly, in the absence of having somebody right now, you can have people do some skin brushing, dry brushing. There are many good books that are kind of the basic, the simplified version of how to do that for yourself or a client. So you can do some lymphatic drainage without having a lymphatic drainage expert there. So our lymphatic system is pumping right now. It just needs a little push in the right direction. It needs a lymphatic system personal trainer. So you can teach people that meditative breathing, the diaphragmatic breathing, that activates the lymphatic system. Easy, gentle range of motion exercises. Exercise enhances lymphatic motility. You can teach them some skin brushing, dry brushing, that enhances lymphatic motility. But to get some good practitioners out there, it would be well worth the effort to see if there's interest and have an instructor, if not me, get somebody to come and teach a course, organize that. Now the magnet therapy, that very much simulates Mother Earth's energy, like the pulse electromagnetic field. It's delivering a different, we have negative energy around us. That's the kind of the energy of disease process, energy of stagnation. Magnets disrupt that cycle and create a flow. It basically just disrupts it like Mother Earth does when she delivers positive electromagnetic energy into our body. Magnets do that on a smaller scale, but it simulates that energy.
Wow. So interesting. Thank you very much. I think we're all going to give you a big Round of applause. Wow.
Thank you.
We will not sing anything to you because it doesn't come off well on Zoom. We all tried singing happy birthday to someone the other day and it was really pathetic. It was really horrible. So we will just smile at you and just honestly, thank you so much, Mike. We've learned so much and I can tell it's just the beginning of a conversation. There's a lot more that we would like to learn, but let us leave with this and, you know, and think about it and work with what you've given us. Like I said, this will be on YouTube, so we'll be able to see it. But meanwhile, we'll all increase that wonderful flow in our body by going and finding some other people in our lives that we can smile at, and that will raise our energy and it will raise theirs too. Thank you so much. Have a rest of a good Friday.
Thank you.
Bye.